As you know, dialysis patients go through a lot. At best, it's always the same, with no surprises and as little discomfort as possible. But to be honest, you never know. Twice or 3 times a week they come to you, and they become your responsibility for a while. And then they leave to return again in a few days. You know the routine. It's up to you to make the experience as pleasant and as comfortable as possible. As a healthcare professional, your single goal is to be working with your patient's best interests at heart, working to improve your patient's quality of life, both while they're in your care and afterward. There is something you can do, however, that will make a difference. We're about to see it in action. The dialysis session is over, and I'm about to remove the catheters and close up the wounds. That's about it for today, Mrs. Evans. If it's okay with you, I'd like you to try something a little different to stop the bleeding, a different dressing, one I think you'll like.
Sure.
Great. It's called a sureseal dressing. It's designed to help close the puncture or graft site in less time and more conveniently than the tape and gauze we've been using. But you'll be the judge of that. The sureseal dressing is what I call an active dressing because it actually does something when I put it onto a puncture site or graft. The pad expands when it comes in contact with blood. As it expands, it presses down on the site. You know, just like when I ask you to press down on the gauze dressing when we're done. The adhesive tape on the sureseal holds the expanding pad firmly in place so that as it expands and increases in size, it presses downward onto the site, helping it to close faster. Here, just press down on it while I clean up. You should be ready to go much sooner than in the past. The pad is completely surrounded on all 4 sides by the adhesive tape, so the site is really protected all around. It's sealed up tight to minimize the possibility of leaking. It's a neat dressing, isn't it? Reduces the mess, and it's more comfortable, don't you think?
I do.
The bleeding should stop soon, so you may be able to leave a little earlier. Let's see how it goes.
It's very comfortable, and it would be nice to get home sooner.
Let's take a closer look at the sureseal self-activating pressure dressing to learn more about what it does to deliver its distinct patient and caregiver benefits. The sureseal dressing is designed to help increase patient comfort and convenience while assisting in the closure of post-dialysis or other arterial venous access sites. The integral cellulose sponge pad expands on contact with blood or other fluids to several times its original thickness. Affixed to a low-stretch plastic adhesive tape, the pad expands and is pressed downward onto the puncture or graft site, localizing and increasing the direct pressure required to close the site as quickly as possible. Firm yet gentle pressure allows the epithelium to close and begin the healing process without disturbing normal venous arterial flow following the dialysis or sampling procedure. The expansion pad is completely sealed on all 4 sides by the adhesive portion of the bandage, isolating the graft or puncture site from bacteria entering the area, forming a barrier against any blood leaking out of the site as it closes, and minimizing the risk of bloodborne contamination to others. The patient benefits are obvious: increased comfort, a dressing that assists puncture site and graft closure, and helps protect the patient's clothing from leakage. And because the puncture or graft site is actively being managed by the sureseal dressing, there's the distinct likelihood that post-dialysis bleeding will be under control sooner. So your patient may be able to leave the unit sooner with greater protection, confidence, and assurance. For you, the caregiver, and your institution, the sureseal pressure dressing greatly reduces the length of direct pressure time required to stop the bleeding following dialysis or blood collection. One study, in fact, illustrates that sureseal can reduce the length of time a nurse or technician has to spend applying direct digital pressure to the site. The sureseal dressing reduces clotting time significantly, so your patients can be out of your clinic and on their way home sooner. There's data to prove that. It means that the dialysis units in your facility can be used more efficiently and therefore more cost effectively. Patient after patient, procedure after procedure. You can realize significant cost savings at the same time as you're improving the quality of care you deliver to your patients. Multiple benefits for pennies a patient. Applying the SureSeal self-activating pressure dressing is really quite simple. But to get the most benefit from the dressing, you and your patient must be sure it's applied and used properly. So let's go through the procedure in a step-by-step manner to focus on all the important steps to take when applying the SureSeal dressing to puncture and graft sites after dialysis or sample collection. Before removing needle, peel off one of the two release papers from the adhesive portion of the SureSeal pressure dressing. Cover the site with the cellulose sponge portion of the SureSeal pressure dressing, securing the first side of the exposed adhesive to the skin next to the site. Now remove the needle. At the same time, cover the puncture site with the cellulose sponge portion of the SureSeal pressure dressing. Be careful not to put too much pressure on the site while the needle is still inserted, as this may cause the graft to be punctured by the needle. Once the needle is removed, immediately apply direct downward digital pressure to the cellulose sponge while removing the second peel-off release paper. Attach the second adhesive portion of the dressing firmly to the skin. Smooth down all sides surrounding the cellulose sponge to help ensure complete sealing around the puncture site. The patient should continue to apply steady digital pressure to the sponge for 1 to 2 minutes as the sponge fills and expands. The patient should continue to apply digital pressure for an additional period of time if you're convinced that the bleeding is under control. The patient is not to leave the bandage on for over 8 hours, as it may cause skin irritation. And that's it. The special adhesive matrix keeps the tape and dressing firmly and comfortably in place and leaves no residue when removed. SureSeal, in fact, eliminates the need for other more traditional yet unpredictable methods of wound site management, such as tape and gauze, or other more expensive types of pressure dressings. SureSeal offers patients and caregivers the best of all worlds: outstanding patient convenience and satisfaction, potential reduced staff time and chair time, and significant cost benefits to the healthcare facility. Actual SureSeal users were asked to comment about their experience with this unique self-activating pressure dressing system.
Well, this Band-Aid is great. I tend to bleed a lot. I have often sat here for a half an hour, applying pressure, waiting for the bleeding to stop. But with these Band-Aids, in just a couple of minutes, the bleeding has stopped and I'm on my way home. I think they're great.
We're fairly confident that you and your dialysis patients will have pretty much the same things to say about SureSeal.